Stephen Towers. I'm Professor of Clinical Psychology and Clinical Professor in Psychiatry at the University of Sydney. I'm also the Executive Chair for the Centre of Eating and Dieting Disorders at the University of Sydney, and I'm the editor of a journal, the Journal of Eating Disorders, that publishes papers on eating disorders worldwide. Yes, I think the facts about eating disorders, there's often a myth that most teenagers will go through some form of an eating disorder during their adolescent years. Many adolescents diet, probably millions of young women across the world diet. But a very fortunate thing is very few will develop a serious eating disorder. If you develop a serious eating disorder such as anorexia nervosa, if you do not recover in those early first few years, there's a real risk that you end up with a long-term, severe and enduring illness that will impact on every aspect of your life for the rest of your life, and tragically for some end up dying much earlier than you should. So I think dieting disorders such as anorexia nervosa, sometimes portrayed as being glamorous, are never glamorous disorders to have. They're serious psychiatric disorders which are often difficult to overcome and can have a devastating impact on the individual that gets them. I think the question I'm often asked is, when do you know that this person is just engaging in a fad diet, and when is this becoming a serious eating disorder? And clearly as a parent, you'd want your child to be treated as early as possible. The data from medical evidence is very, very clear. The earlier you get in to treat an eating disorder such as anorexia nervosa, the more likely you are to recover. So there's no doubt in my mind, after 30 years of experience in this field, that early diagnosis is essential. One doesn't also want to over-dramatize a behaviour that's not likely to cause serious concern. But I think if a parent is seeing behaviour that seems to be becoming fanatical, that it's rigid, that the person can no longer act in the flexible way they did before with food, then usually I would think a trip to the GP to discuss it and get the GP to have a look at whether they feel this is progressing to an eating disorder, because the data is clear. The earlier you treat an eating disorder, the more likely you are to fully recover. So the earlier you get in, the better. Another question I'm frequently asked is how often eating disorders are associated with other psychiatric disorders. And in a study which my group did with Dr. Jessica Swinburne, we looked at patients presenting with eating disorders and looked at how many of them had an anxiety disorder previously in their life. And up to 75% of the eating disorder patients we surveyed had had an anxiety disorder early on in childhood. So anxiety disorders in childhood are often a common symptom for which patients don't fully recover from. When they develop an eating disorder, the anxiety disorder is still there in some form. Another disorder such as depression is very, very common in patients who have eating disorders, and often then you have to treat a complex array of disorders such as obsessionality, anxiety disorders, depression when you're treating the eating disorder. Question again here is, what roles do schools play in alleviating and preventing eating disorders? Sadly, some eating disorders aren't preventable. There's a genetic basis to that, and with severe dieting and stress, those individuals are likely to go on to develop an illness such as anorexia nervosa. I think one has to be very careful what one does in schools, because some prevention programs that have gone into schools overseas to prevent eating disorders have actually caused more eating disorders. Because if you talk to adolescents without enough support about eating disorders, some of them actually hear and learn things that they hadn't been aware of before, and actually cause them to develop more serious eating disorders. I think one has to think carefully about what sort of prevention strategies. And my understanding is that strategies that build self-esteem in adolescent people, build up their communication skills, improve their body image and make them feel better about themselves is a better way to go than addressing eating disorders on their own. Because understanding eating disorders does not necessarily mean you will prevent them. Understanding and developing a stronger body esteem, more assertion, ability to communicate, and more self-confidence appears to be the way to go.